but the abuse of the parent, it needs to be stopped. Work with others in your facility. It needs to be a team effort, not an I effort. Many times we overlook the team. If you feel that you're not getting the, quote, team effort, go to your administration and say that you would like to have a meeting to maybe help the morale issue when it comes to team effort, the abuse, the issues in the home, the hospital, the independent living, the assisted living, wherever you work in the nursing field. Get together with your administration and work things out. Don't let the abuse continue. If you're a nurse and God has put you there, please check yourself and make sure that you really, really are working with your team.
Mm-hmm.
And just because you were certified and went to school to be a nurse, please, out of respect, please don't think it is all about yourself, because it's not. You were put there for a reason. Just because you have schooling doesn't make you God. God put you there for a reason. Please check yourself and work according to that. I respect the nurses, many that I've worked with. I respect a lot of you. Unless you get to a point where you cannot handle yourself, I respect the administrators, because I know God has put them there for a reason. I know that there are issues that do happen in the homes between nurses and administrators. Those need to be brought to upper management or your corporate. If you suspect something between your nurses and your administrators, which I have seen firsthand, do not go to them. Go to your corporate administration or somebody that
will help you.
Knows the individuals, and sit down with them, tell them what has happened, and make sure that things are put to a stop. You can remain anonymous. It doesn't have to be, your name does not have to be out in the public eye to help stop any of the abuse or what is going on between nurses and administrators. Firsthand, I want to say thank you to all of the caregivers, the nurses, the doctors, and the many specialists that are in the caregiving industry. Thank you for stepping up to the plate for what you do, because without you guys, our geriatric society would not have the great response to getting the caregiving. I've been in it for 23 years. I have all the respect in the world for all of you who do the caregiving. But please, like I said, if you suspect anything at all, please go to your upper management or somebody that you can trust going to talk to, and not letting it continue. It's important that we all work together. You can always go to a pastoral consultant if you suspect something that you can't go to upper management. Please go to a pastoral counselor or a pastor that may have some type of influence in the medical industry that they could go and talk with the management, and you would not have to be involved, and they can do it anonymously. But please do not let it continue. Look out for those, and all those of you that know that you were put there by God, please be an advocate for our elderly geriatric society, because they depend on us to be caregivers and to be a voice for those